So my name is Lorena Verdugo, and I have been working for Rio Community Health Center for the past going on 12 years. And through there, I also am a coordinator for the Ventanilla de Salud program, which is located within the Mexican consulate for the last 8 years. We have a memorandum of understanding with them. I also am part of the Community Health Workers State Association, which is AzPRC, and there I have also been part of the board and now hold the chair for the last 12 years as well. So being a CHW, or a community health worker / promotora, community health advisor, there's so many titles out there, but I see them all being under the same umbrella, has been very rewarding actually. I never saw myself actually enter this workforce. For me, it kind of started out being, I was in the workforce before I actually started or went to school for it or had the certification. It was kind of more of a hands-on, but the meaning of it is actually it has a lot of how can I say this, valor in Spanish, weight to it. That's what I wanted to say. A lot of weight to it because there's so much into it. We can be support for many people. We can be counselors to many people. We can be that resource for many. We can be that shoulder for many. We can be that one person that kind of opens the door to so many things. Many of the times, community health workers are just focused on one certain chronic disease, or we can do many different diseases or work on different topics. But for many people, I've worked a lot with cancer patients and also with depression, and many of the times I see that while they're going through that, their whole mind just closes up because either they've been given that diagnosis or they're going through these certain situations where just their mind just closes up in the whole situation because of whatever they're going through. They close up and they don't know what to do, and you're that one person that can kind of open up that for them and kind of see that light or problem solve for them during that time. So that's the beauty of the work, and that's what we hold, and that's probably the beautiful the meaning of it, in those three letters, the CHW, or the community health worker. So a day-to-day activity for me, or a day within the life of Lorena, that's interesting because there is no day the same, and I think that's the best thing about my job is that there is no day that is the same, and that's what's kept me here for. Although I've been here in this position for 12 years, I think I've been a promotora for over 12 years. I started out doing community work for over 12 years when I worked in the school district and doing home visits in another program. But a day-to-day, like I said, there's no day that's similar. In the morning I get in, and sometimes I have people following me from the parking lot to the office, just waiting to see me, either because they need to apply for certain medical benefits or for food assistance. There's times that I come in and there's just people here to greet me and just to say thank you for something that I have helped them with. If you can see the surroundings around me, there's just a lot of colorful things, and you might maybe think it's a little messy, but a lot of these things have been gifts that people have given me, an appreciation that they say, oh, I bring this back to you because you helped me with whatever it is, and those are the blessings that I count each day. Very, very busy. There's days that are just super draining. There's situations that just suck the best energy out of me, and there's days that fill me up with energy, depending what the circumstances are. But I do a lot of one-on-one case management, problem solving. A lot of there's certain days where we do education, provide information around diabetes, heart health, and for that we use curriculums, many that we bring in or that we've been trained on from, the public health college. We use many from the Prevention Research Center. We have partnered with different organizations that we get trained on. We, as community health workers, also provide a lot of community resource sharing, refer people to get whatever it is that they need, whether it's housing, whether it's food, whether it's childcare, whether it's transportation. We kind of go all around that social determinants wheel with the person that we're helping. Another thing is also organizing events. So maybe once a month there'll be like a health fair that we organize, or that we bring in resources or tables for the people that are in the waiting room to have that information available for those that may need it. Different things. People coming in with incoming mail that maybe they need translation or that they don't understand the terms. Just the literacy levels, just kind of translating what the meaning of it is, what the court, what they're trying to let them know, or if they need to know around that. Around tax season, we refer them where they can go to get that done. It just all depends. But there is, like I said, no day that's alike. Every day is something different. One day can be quiet and one day can be super busy. But that's the day in the life of a community health worker. So the Prevention Research Center has impacted my role very greatly. I should actually express at this time and take the opportunity to thank the Prevention Research Center, because I've been part of the Community Action Board through the Prevention Research Center for about, I want to say now maybe 4 or 5 years actually, because I believe I came in during the first 2 rounds. Where I'm going, it's been a while. But anyhow, because thanks to them, I've been able to grow professionally. A lot of it has been through the curriculums that have been offered. I've been able to train on the curriculums and also become a trainer of the curriculums. So I've been able to grow on that. Leadership is fabulous because I've been able to become a leader thanks to that. The networking is also a great way to establish that communication with the different people that attend and that have that connection with the prevention research centers. I know that in different occasions we've been able to connect with those people that have funding available for the different programs and the different areas that we are looking for to fund programs on, for example, chronic disease and behavioral health or maternal health, and we've been able to make those connections thanks to the PRC. Nationwide as well, I've been able to serve on a committee with the PRC on a national level and make those connections as well. So there's been a lot of growth thanks to the Prevention Research Center, and I'm happy that I was approached and invited to be part of that, and still able to participate. So good job, PRC.